And the last anxiety disorder is generalized anxiety disorder. The hallmark of patients who have generalized anxiety disorder is that these are women who worry about everything. They worry about things they should, and they also worry about things they don't have to. They worry about their families, if their families are doing okay. They worry about their jobs, even though their jobs are secure. They worry about their children, even though their children's lives are perfect. They can't help themselves. They can't relax. So they also have the physiological components. Now, the risk factors for generalized anxiety disorder are just like all the others, tends to be genetic. So these are women who have a family history of this type of anxiety disorder. It's relatively common, about 5% of the population, more common in women than in men, approximately 3 to 2. It does occur early on, so during childhood, these things are starting. And basically, these are individuals who, when they're stressed, you know that their symptoms are going to worsen. These are patients who also, because they can't relax, because they can't enjoy themselves, because they can't have a good time, and they're constantly worrying, they're also going to have depression. They're also going to abuse drugs, and they also have a lot of somatic symptoms. Now, the treatment of choice for these women will either be behavioral therapy or pharmacotherapy. When looking at pharmacotherapy, numerous medications are available. Buspirone is an anti-anxiety medication, which is approved for the treatment of generalized anxiety disorder. Benzodiazepines are anti-anxiety medications. However, when comparing anti-anxiety medications, buspirone versus benzos, the better answer is buspirone. Why? Because it has the approval for GAD. They're in the same class as far as anti-anxiety. When you're comparing buspirone to an antidepressant, an SSRI, for example, then the treatment of choice will be the SSRI and not the buspirone. So you have to be very careful in the choices that are given to you as far as the pharmacotherapy of generalized anxiety disorder. And as far as behavioral therapy, you're going to use the exact same things that you would in the others. Any relaxation technique, any kind of deep breathing exercise, even biofeedback if necessary, will help you in the treatment of this disorder. Let's look at a case. A 31-year-old local politician has a sudden onset of extreme anxiety, tremulousness, and diaphoresis immediately before his first scheduled appearance on national television, and he is unable to go on the air. For the next week, he is paralyzed by fear each time he faces an audience, and he cancels all of his scheduled public appearances. What does he have? Does he have acute stress disorder? Does he have an adjustment disorder? Does he have panic? Does he have social phobia, or does he have a specific phobia? What he specifically has is stage fright. And where do we find stage fright? In D, social phobia. And how would we treat him if he did have the stage fright, which indeed he does? We would have to give him beta blockers. You tell him to take the beta blocker anywhere from 1/2 hour to an hour before any kind of public appearance. And that will relieve all of the autonomic hyperactivity.